Hello, everyone. I'm Fernanda Wanderley. I'm a senior data scientist at Economy, and today I'm going to talk to you about AI applications in health industry. So you could wonder why using AI in healthcare. It's generally healthcare. The first thing that we thought is that healthcare is for humans to humans, but AI can provide lots of help in this case. So why using it? First of all, we have a huge amount of data produced every day. According to the Health Tech magazine, an average hospital produces roughly 50 petabytes of data every day. So it's a huge amount of data. It's unfeasible for a human being to analyze this amount of data. And also, by analyzing this, we could have lots of insights on healthcare and how to provide a better healthcare for patients. We also have mixed type of data. So we have medical imaging, lab tests, genetic data, and so much more. So when we have tons of structured and unstructured data, AI it's a good uh, tool to use. It's a good method to use. And we also have a shortage of doctors. So depending on the country, I'm speaking from Brazil right now, we don't have enough doctors to analyze this kind of data. For example, here in Brazil, we have 14,000 doctors in the entire country. And most of those doctors are currently in the center part of the country. So in the north regions or northeast regions, we don't have the same amount of specialized doctors in this. And for the applications of AI in health, first of all, we have the medical imaging. Medical imaging are just like X-ray scans, CT scans, mammograms, and generally for this kind of data, we use CNNs, which stands for convolutional neural networks. They're a kind of AI that learns the feature of an image, in this case, medical imaging, and then it points out which pathology could be in that exam. So, for example, we have this X-ray exam here, and then we pass it through the CNN architecture, and then it learns to distinguish between a normal exam and an exam which has a pathology. And this could be of a huge help for a medic that is not a radiologist, which is the kind of specialty uh, that knows how to read this kind of imaging properly. And so we could ask at me also, oh, but why the doctor should trust what the AI is saying? And in this kind of AI model, we can have the explainability. So, for example, in here we have an X-ray exam that has lung opacity, and in this blue cloud we have the area where the doctor should pay attention to diagnose correctly the patient. We also have the mammogram, which is a huge imaging and generally is used for scanning for nodules and calcifications in the breast. And in this slide, you can see at the left side that we have just a small nodule inside the red square, and on the right hand, it's bigger. Those two images have 4 years, are separated for 4 years. And in the first one, the AI method had point out that this could develop to a malignant nodule. And in the right side, it in fact developed it to this kind of disease. And these represent a huge gain because when we diagnose early a cancer, the prognosis is much, much better. We also have the health records. The health records are the electronic medical records and also the reports that the doctors does for a medical imaging. And by having this kind of data, which is very unstructured, we can use LLMs to extract and organize the relevant information of this. And by using these, we can, for example, say, oh, this patient should receive a proper care for diabetes, for example, because it has a huge risk of developing it, for example. And which are the advantages of using AI? We have some advantages. We could provide faster care because based on the results that the AI gave for the medical imaging, for example, we could triage our patients and then provide a better care for the ones that have the most urgent need. Because sometimes when we got to the ER, we answer some questions for the nurse, and she can assess how bad we are. But sometimes we are not feeling bad, but the exams say otherwise. So this is a good way to provide faster care. We could be more efficient also because the doctors that are less experienced, for example, can identify pathologies more accurately. So, and by being more efficient, the doctors has more time to care for the patients, more time to talk to them about what they're feeling, and to listen more for the symptoms and to provide a better care. Also, we could use, for example, when we are talking about the electronic records, we could use it alongside with the family history, for example, to assess if a patient has a higher risk of developing a disease, for example. So, as I said before, we could, for example, say to a patient that he needs to be in a prevention care for diabetes, for uh, has, which is high blood pressure, for example. So we could provide care before that patient got sick. And we also can do patient discovery, so for drug trials or other kinds of uses. And that's all for today. I hope you enjoyed. Thank you so much.